Hi everybody, my name is Ahmed Al-Hanemi. In this video I'm going to talk about melanoma. First of all, let's define melanoma. Melanoma is a cancer that originates in the pigmented producing cells of the skin, which we call it melanocytes. It can occur anywhere including skin, eye, and mucous membrane. It is the most aggressive type of skin tumor and the first cause of death. And the most common cause of skin cancer is basal cell carcinoma, but the aggressive one is melanoma. Here is the anatomy of the skin. We have 3 layers of the skin. We have a epidermis layer, then dermis layer, which contains blood vessels and nerves and lymph nodes, and the third one is subcutaneous tissue. The dermis layer consists of 2 layers. First layer is papillary layer, then reticular layer. And if we take a dissection from the epidermis layer, we can see the cells. We have squamous cell, and also we have basal cells, and we have melanocyte. If you can see here, melanocyte is the deepest one. That's why it's the most aggressive one, because if the cancer is happening here, it could transfer to the blood vessels and lymph nodes because it's so close. Epidemiology. The incidence of the melanoma in the USA has increased during the last 50 years and is now 15 per 100,000. About 48,000 melanoma-related deaths occur worldwide per year by WHO. Melanoma account for more than 75% of all deaths due to skin cancer. The most common site in female is leg and in male is trunk. We have classification of melanoma. We have pre-malignant, which we call it Hutchinson's freckles. Usually occurs in the elderly. It is common in sun-damaged skin on the face, neck, and arms. The abnormal skin area are usually large, flat, and tan with areas of brown. High incidence of development of invasive melanoma. And here, invasive types. So we have 4 types. Superficial spreading melanoma, which is the most common, and we have nodular melanoma, about 15%, and acral lentiginous melanoma, which is about 5%, and we have lentigo maligna, about 10%. As you see here, this is the superficial spreading melanoma, the most common one, and mostly it happened in the trunk. And nodular melanoma, usually it's black or blue. And lentigo maligna melanoma, usually it occurs in the face and neck. Acral lentiginous melanoma, which is the rarest one, it could happen in the nail or mucous membrane. We have pre-dose depth. If the tumor is less than 1 millimeter, 5-year survival is 95% to 100%. If it is from 1 to 2 millimeter, 5-year survival will decrease. It will be about 80 to 96%. If it is 2.1 to 4 millimeter, 5-year survival is about 60 to 75%. Greater than 4 millimeter, 5-year survival will be the least, about 37 to 50%. And also have Clark levels. Level 1, which we call it melanoma in situ, just in the basement membrane. Level 2, invasion of the papillary upper of dermis layer. And level 3, invasion fills the papillary dermis. And level 4, tumor involvement of the reticular dermis, and level 5, invasion of the subcutaneous tissue. We will see picture. Here, Clark level, as you see, the level 1, just in the basement membrane, we call it situ. The second one, level 2, is start to invasive the dermis layer. Here, it fills the papillary layer. and the level 4 it treats the reticular layer, and level 5 it treats subcutaneous tissue. The most common site for metastasis is skin, dermis or distant nodes about 50%, and the lungs, the second most common site, it is about 30%. Here are the risk factors. The most important risk factor is the sun exposure, and the second one, if the patient has blistering is accumulation of fluid due to sunburn, especially if the patient had it before in the young age. And if the patient has a lot of moles, as you see here in the picture, especially if it is above 50. And people with fair skin and blue eyes, they are more susceptible to get the melanoma, and old age play an important role. Here is the guideline to differentiate melanoma from the other cancers.